The Centers for Disease Control found that Wisconsin had a 109% increase in emergency room visits from opioids just last year.
Drug overdoses from opioids are on the rise across Wisconsin and in Crosse County. News 8's Scott Behrens is here to tell us what is being done locally to stop it.
Well, Wisconsin has the notorious distinction of having a bigger increase in ER visits from opioid overdoses than any other state. In our area, the Crosse County Health Department says 29 people died of drug overdoses in the county last year, and more than half of those deaths were due to opioids.
This is a disease. It's not a choice that people make.
JT Savor is a recovery coach at the Cooley Council on Addiction.
They need long-term support. They need extended, more than 30, 60, 90 days of treatment. It takes years.
He's also a recovering opioid addict.
Been sober now 5 years.
Savor's addiction started when he suffered an injury during Army training.
Just had a host of different injuries while I was serving, and as the story goes for a lot of people, you just end up taking those for too long and eventually it just becomes an addiction.
Savor was prescribed Oxycontin before he was deployed to Iraq.
I was getting 240 5 milligram to 10 milligram pills a month, and I just had low back pain, and that's a ridiculous amount.
Before he knew it, Savor was taking 10 to 20 times the prescribed amount every day.
In excess of 100 to 200 milligrams of Oxycontin a day.
Even multiple overdoses couldn't stop his addiction.
Refused to go to the emergency room and just fought through it, and luckily survived.
Eventually, Savor realized if he wanted to stay alive, he needed to get help.
Just made the decision to seek some help, which was the first biggest, hardest step, was to ask for that assistance.
Stories like Savor's are the reason Alliance to Heal formed less than 2 weeks ago in La Crosse.
It's a new partnership between both healthcare systems, the La Crosse Community Foundation, as well as the continued support of La Crosse County Health Department to make an impact on the opioid epidemic in our region.
Savor says other addicts can get sober like he did, but that won't happen unless they get help.
As a whole, we need to do the best that we can to support them in getting the tools that they need.
Crosse County Health Department says more than 800 people died last year in Wisconsin as a result of opioids. For comparison, around 407 people died in the state from car crashes.
All right, thanks a lot, Scott. And if you or anyone you know needs help recovering from addiction, you can always visit the Cooley Council on Addiction any day of the week from noon until 8.
The center says there is always a recovery coach there to talk with people.